Good morning and welcome to the Bryan press briefing on Tuesday, October the 6th, 2020. I'm John Woodrich, CEO of Bryan Medical Center. And today we have Dr. Joel Greisen with us, a pediatrician who's going to talk about flu shots and do a little follow-up from the mental health aspect of the video that we saw yesterday or that was available to people about devices and social media and the effects on youth. Before I get into the numbers, I just want to stress to people again, please wear your mask, please social distance, and try to avoid the big gatherings. You know, as we continue to deal with this pandemic, I don't think we could stress that enough. I will tell you personally, I let my guard down at times, but it's hard to continue to keep this up because everybody wants this to be over, but it's going to take more time. So we have to keep each other accountable. So please, when you see your friends not abiding by it, make a comment to them. This is important for us in order to manage this pandemic. With that, our numbers, our census was 484 at midnight. We've now tested 25,489 individuals, 2,949 positives. We have 96 pending, which is a low number, and we still are seeing great turnaround from our outside lab. In-house, we have 46 positive COVID patients. 25 of those are from Lancaster County, 21 from outside of our county. 7 of those individuals are on ventilators, 4 from Lancaster County, 3 from outside of our county. We have 13 individuals in our intensive care unit. And I do want to just make a comment about our intensive care unit. I think the other day somebody had raised the question about how many ICU beds that we have. As an organization, we have about 30, but we have the capability to get into the 80s should that need arise. So I just wanted to add that point of clarification. And then in our progressive care unit, we have 5 individuals, and in our general care unit, we have 28 individuals. And with that, I'm going to turn this over to Dr. Joel Greisen.
Even as far as numbers go, John had pointed out where things are at within the Bryan institution. Within our office in the first month of the school year, we've seen nearly 713 kids come into our office with various symptoms, most of whom are school-age kids and require testing to be cleared to return to school. Of those 713, we've only had 33 positives. So it's telling us that there are certainly other viruses, other infections out there that are causing these symptoms. That makes us feel better that we can return these kids. Again, most of those are mild symptoms, but they need clearance to be able to return to school. So, but I think as the winter comes on, we're going to need to make sure that these kids are immunized appropriately, and flu vaccine is a big part of that. In mid-September, we were able to have our first drive-through flu clinic. We were able to do 300 kids on a Saturday morning in about a 2 to 3 hour time span, and it worked very smoothly. In fact, our staff was excited to be able to be part of that and to see the numbers come through. We are putting on another drive-through flu clinic this upcoming Saturday for our patients and anticipate in the range of 500 to 1,000 that we should be able to get done. So we're still promoting get your flu vaccine. Try and do that before the end of October with your kids. For those that have never been immunized against the flu, they will need 2 doses this year, separated by about a month. And again, trying to get that done early so our kids are immunized before the flu season hits. I wanted to talk a little bit about just the negative consequences that come with social media and electronics in our youth. Many of these are things that I think are obvious to people, others maybe not as much. Restricted brain development in our very young, especially when they're exposed to long durations of electronic or device use. Obesity, we see nearly 1/3 of our pediatric population that fall into the obese category nowadays. Sleep deprivation for obvious reasons, I think especially in our teens and preteen age group where they're often on their device late at night, sometimes even under the covers. So I think unbeknownst to many of the parents. Mental illnesses we've seen climb greatly during this whole electronic age. And with our youth and many young kids under the age of 12 having a device of their own for the first time. Studies show that there is an increase of nearly 60% in pediatric emergency room visits for mental health related issues, and that in that same time span from about 2006 until 2016, studies show that increase in suicidality has gone up by nearly 70% in teen females, and in the preteens by nearly 150%. So it's a real issue and one that we want to draw more attention to. So in our office, we talk a lot about anticipatory guidance in preparing our parents and the youth for a life of well-being. We think it's important that, for those that are 0 to 5 years of age, that parents avoid electronics altogether under 2 years of age, if at all possible. For those that are in the 2 to 5 year age range, limiting it to 1 hour a day would be advisable. And making sure even then that the quality of the programming is something that parents would approve, that parents watch the content with their child and follow it up with face-to-face time in discussing what their child has seen and how they're processing that information. We believe in device-free meals, and that includes no television time on, and media-free zones in the house where there are distinct areas of where a child can view content and areas where they are free of that to play away from those devices. And then, of course, always ensuring that they get adequate physical activity, sleep, and face-to-face communication. Parent-child talk is part of that. And then I believe that all devices should be turned off when they're not actively in use. A lot of times it's background noise, and our kids do pay attention to that. So beyond early childhood, for those that are school-aged and adolescents, some of the anticipatory guidance things that we talk about in our office are placing appropriate time limits on your child's device, ideally less than 2 hours a day. But in any case, sitting down and talking to your child about what they think is reasonable. Most kids will, with the help of their parents, come to a reasonable decision that you guys can then enforce afterwards. Instituting a family media use plan. There is a website there that follows that is a great example of how to set that up and put that into action. As with younger kids, keeping all devices out of the bedroom and starting that at a fixed time each night so that it's clear with your child when they will have to turn their device over. And we encourage that 30 to 60 minutes before bedtime. No social media till high school. And this is a big one because kids now, when they're obtaining their first device, sometimes in that 10 to 12 year middle school age range, already parents don't realize that the availability of social media and the content that's on there quickly comes to light, and that it's uncensored, and that unless parents are paying attention to what content their video or their child is consuming, they may be unaware of the dangers. So trying to push social media off till high school and preferably after 16 years of age when a child's emotional state of health and their ability to process the information is a little bit more adept. Device-free meals and media-free zones. Discouraging use during homework. I see with my own kids how frequently where a notification or an alert comes up that they will constantly grab at their phone instead of continuing with their homework. And that constant disruption or interruption does lead to poor academic performance in many cases. Promoting healthy sleep habits with our older kids, activity, academic, and socially. Turning off notifications so there's not that constant blurb. And then knowing your child's phone. What are the apps that they have on their phone? What kind of social media platforms do they use? And the content that they're using. So essentially sitting down with your child on a regular basis and viewing that together. What are they consuming? How are they viewing the content? And what sorts of solicitations do they have from the other end. So I think mostly I wanted to bring this to public awareness. There are many different platforms that are starting to show that more now that we have more data that's in. I think 10 to 15 years ago when this started, this whole revolution of everybody having a smartphone and then eventually handing that over to our youth, we weren't aware of the inherent dangers that came with it. And so people need to have places that they can turn to for the right information and ways to assist them with their own children. And there are just a few here. There are many others, but the healthychildren.org media use plan would be one. The commonsense.org is a place of video content for young kids that parents can feel that they're confident in their child's use, that it's been evaluated ahead of time. And then in regards to the talk last night by Colin Karchner, Save the Kids is his hashtag. I think it's an excellent talk. I would advise anyone, if they have the opportunity to log in and watch that, would be great. But I also think, to expand on that, his hashtag is Save the Kids, but I think before we can save our kids, we have to save the adults ourselves. You know, we are models for our children, and unless we can control our use and know what our content is, and the inherent dangers and the addictions that come with that, it's very difficult to protect our kids from the same. So I would encourage people to educate themselves more and do that first for themselves. I think until we look at ourselves in the mirror and understand where we're at with our device and how much that alone affects our kids even before we hand them over a device of their own, it's hard to then teach that to our children.